moving into the present context, like how has COVID affected your unit?
So I think I would say that last last year, even though it's just like a couple of months ago, last year I was already a telemetry nurse manager for that's running into my fourth to fifth year, right? We are most hardly hit by COVID. That's because that we didn't even know that there are patients that are tested at that time prior to the beginning of March. There were other patients that actually had been admitted that they were not diagnosed yet. We we were exposed to, let's say that. And even though my unit was hit hard in terms of that, uh, where 85% of my employees were positive for COVID-19. And fortunately, one of my assistant manager died. The first nurse documented died in COVID-19 in New York City. That's
Are you
Kayus.
able to say their Are you able to say their name if
I think it's well known. That is Caius Kelly. That was the first um, nurse who documented who died in COVID-19 in March of 24, March 24. So we work in the same area. Um, and I myself, I was diagnosed as COVID positive the same time with my assistant nurse manager. And unfortunately, I could not really pinpoint as to where the exposure was and who was the exposure was, but I know slowly my staff had came out positive for COVID-19. Was very hard because I was also quarantined. During the height of the pandemic or just the beginning of the pandemic, even though I'm home, I was relentless, just trying to see what I can help with um, supporting my staff. So mostly I document if I know someone is out, I call them, I reach out for them to see how they're doing, how they're feeling. There's a lot of anxiety, a lot of stress, and they don't know where to go. Well, they want to get tested. It's not like now that it's more organized. Where do you go? There's places to go. Um, I remember people are crying on the phone. I remember them saying, "What I'm gonna do now?" I said, "For now, there's nothing you can do. If you just have to support them one on one." And I have to call them day and night to see how they're feeling because if I am feeling low and stressed out, they must be feeling worse. So at that point, I did offer suggestions or offer a recommendation. I said, you need to call employee health. We need to document that, from the day, the time that they were out, and how can we support them. Then I was the voice. I was the voice of my staff and talking to administration when I came back from quarantine after knowing that my colleague had died. I pick up and I said, my staff needs help. They need to be tested. They need to, some of them, they could not reach out their providers. They could not reach out their PCP because their PCP is also no offices. So we really need to do a telemedicine for them. So I reached out to my administrator and because they asked me, Janet, what can we do for you? I said, there's only one thing you could do for me needed to do for my staff. And that's where we mobilize. I give them all the telephone number. They did the tele. They got the resources, a doctor or an NP to really call, even though they've been called before, but it's not just calling them, finding how they're doing and documenting about their COVID experience and documentation that they were out. But that's not what they need. They really need help. They need help in terms of clinical, like your own PCP, like your doctor telling you what to do next, and and where. So that's I'm glad that they were able to mobilize them so fast, and the it went on. It's one after the other, and then slowly until the March, April, people come back to work, there's still another batch of people going out, so it was continuous process. So you're there for them, just telling them mentally. And then I think the support, I started the group support that we have, with the help of our behavioral people. I run the support group for 14 weeks in the hospital. I'm the only unit who ran a support group for 14 weeks with behavioral health. um, so after that, we also do I do a self-care, a follow-up self-care with them, and a project of self-care, inspiration, and healing. Wherein I challenge them, I give them incentives as to how did you cope during this pandemic? What are, ways of coping pandemic, and how do you do self-care? So I gave them some incentives by, we did a bake off, cook off, and then I let also other people who taste their baking and give them incentive. They also, they said that one of the areas that they to do self-care is they do exercise, and they captured that by through pictures. They send me pictures, and I made a collage of their pictures doing their self-care. But meanwhile, there is ongoing a group session for their mental and support group. A lot of us, I challenge those people who makes cups and masks, to give me their display, and we meant to have it displayed. And I also was able to finance something and give them a sewing machine. Whoever won the best, for making the cups and masks, I gave them as an incentive. I gave them a sewing machine. But that was and it is ongoing on how can they do really self-care for themselves. And these two documentation, I had it on my bulletin board. And the project was to really help them pass this COVID. And now that we're surging again, and helping them, making sure that they can go where they have all the information that they need. They have all the supplies that they need. They have the equipment that they need to work with, and just the ability to express themselves. Because at this point, we've said that even though we have all the elements, we have all the equipments, all the supplies, but you're still anxious about what's the effects. And even though with the vaccines, the promising of vaccines, there's still percentage of people who don't trust it. And how can we help them get through it?